So, good morning, everyone, and welcome to our second Youth and Young Adult Substance Use Prevention Recovery Symposium. So, it's 9 o'clock now, and that's the time we decided we're going to start. Um, I just want to make a couple announcements. First of all, I just want to say thank you for taking the time to travel and register and being here this morning, because without you, of course, this wouldn't happen. I also want to mention just a couple things to people be aware. There are some agendas on the tables there that can remain on the table that you can just reference so you can see the order of presenters for the day. And then you can just keep them on the table there for throughout the whole day. The other thing is, this year we decided to have the food and refreshments in the Oak Room. So feel free to stand up and get coffee, tea, or water, or muffins. Like around 11 o'clock, there'll be a lunch shift, and they'll be in the same room, and then at 2 o'clock, there'll be the afternoon snacks. And the other thing I just want to mention for you who are here for the first time, the bathrooms are down the hallway through the lobby, down the hallway to the right. So I just want to make sure people know where those are at. Again, thank you again for being here for the symposium. And we have a full agenda, as you can see. And I just want to, first of all, introduce our first opening speaker, Ebony Clark from the Oregon Health Authority, Behavioral Health Director, brings more than 25 years of experience as an administrator, manager, and clinician in both the public sector and nonprofit behavioral health arena. Ebony has influenced policy centering the work with an equity and consumer lens. Prior to this role, she served in multiple leadership roles during her 12 years at Multnomah County, and most recently as Health Department Director, overseeing public health, behavioral health, corrections health, and the federally qualified health centers. Before that, Ebony served as the county's behavioral health director. Before joining the county, Ebony worked as a service director of child and family services at LifeWorks Northwest, and in that role, she oversaw child and family outpatient mental health prevention and culturally specific adult mental health and addiction services. Under her forward-looking leadership, Ebony led the Multnomah County Department during the pandemic with a staff of 1,900 people and a budget of over $400 million. The county was a regional leader in the COVID-19 response, standing up vaccination clinics for low-income and underserved communities. She was instrumental in establishing the Behavioral Health Center, Health Resource Centers, which serves more than 1,000 people a week in downtown Portland. Ebony's mission is to build and sustain a behavioral health continuum of care that is consumer-focused, equity-focused, and effective in meeting the unique and complex needs of every person in Oregon to promote healing and well-being for individuals, families, and communities. A licensed clinician, social worker, Ebony holds a Master's Social Work from Portland State University and a Bachelor's of Arts from the University of Oregon. So let us now welcome Ebony as our opening speaker. Thank you.
Thank you. That was a little embarrassing. I forgot to tell Bernardino to cut my opening down to 3 sentences because it's not about me. It's about our youth. It's about our communities. And I'm just excited to be here. I think last year I had shared that I graduated in undergrad from University of Oregon in 1999. You know, way back when I thought I wanted to be a teacher. They saw something different and encouraged me to become a social worker. And I'm so appreciative to the universe for, you know, what I do. I often say that we are in critical times right now in our society. I say and I believe that when we think about all of the challenges, when we think about all of the need, and when we just think about kind of the current state of our environment, our society, it's easy to become hopeless, but we can't. You know, I often talk a little bit about my story. You know, my mother was a heroin addict. I was born drug affected. I was in foster care till 1.5 years, but then my mom went through residential treatment program, a program that catered to African Americans, one of the first programs that catered to African Americans and welcomed African Americans in the mid-'70s. And because someone had hope and because someone cared, my mom was able to start her journey of recovery. And that has inspired me to this day, to never give up hope. And when we're talking about substance use and when we're talking about our youth and our families, I owe it to my mother, I owe it to my family, I owe it to my people, the community, to always reach back and give back. So I always like to take a moment to just share a little bit of my why. And I know many of you, and I'm also a believer that we all have a story of why we do what we do. And it's because of you all that hope is not lost. And so I'm honored to be here this morning to just, open up the session. I think that, there continues to be a lot of focus on the adult system. Recent efforts to ensure that youth and young adults it's important for us to make sure that youth and young adults are a part of the discussion, recognizing how important it is to bring youth and youth services into the spotlight is key and critical, and I believe that we have to take every moment and every chance to do that when we're thinking about policy, when we're thinking about services and supports, when we're thinking about solutions. We all see and understand and could stand up here and talk about the workforce challenges, and I often think about the peer community. I think about lived experience. I think about living an experience. And then the key word prevention is always at top of mind for me. And I believe that especially with where we're at today and as we think about the challenges that our young people are grappling with, I really believe that one of the saving graces really centers on both prevention work and peers. So I just, again, have to name it. As we think about the shifting landscape in Oregon, quite frankly, the philosophy Raleigh has become this purview of accepting substance use. At least in the community that I live in, there seems to be this just acceptance that youth are going to drink alcohol and that use cannabis, and that's just the way it is. And as long as a young person isn't ending up unalived or incarcerated, it's no big deal. But that's not true. I also want to recognize that when we think about our data and we think about our numbers and we think about the inequities and the disparities, we also know that we have certain communities that are overrepresented and impacted and oftentimes end up impacted by overdose, end up impacted by homelessness, and end up impacted by incarceration. And so we cannot continue to take a casual stance to the current state of substance use. And I just want to applaud you all for continuing to, lead the way and be the trailblazer in this ever-changing climate. I also want to talk a little bit about what OHA is doing. We've continued to work collaboratively with the Alcohol and Drug Policy Commission, also known as ADPC, and the System of Care Advisory Committee to think about how do we assure that we are prioritizing how we're understanding and how we're going to bring forward solutions and strategies to better meet the needs of young people. The last thing, a couple things I just want to say is that efforts are beginning to work. Although we know that people are still hurting, our data shows that prevention efforts in Oregon for youth 10 to 17 are lowering the fatal overdose, specifically to fentanyl. Some other statistics that I think is important to make sure is named, and this is coming out of our SB 238 toolkit. Overall, binge drinking and commercial tobacco use is decreasing among Oregon's youth, mirroring the national trends. However, fatal overdoses continue to rise for youth ages 5 to 17. and that tripled between 2020 and 2022. Fatal fentanyl overdoses among youth ages 5 to 17, while it has tripled from 2022, we do see a lowering of that, but it's still not enough. For the first time since 2019, national provisional data is showing overall decreases in overdoses in U.S. Provisional data shows overdoses of deaths continue to increase, though, in Oregon in 2023, but are slowing. That started to slow in 2024. The most recent provisional data for Oregon is showing decreasing fatal overdoses among youth aged 10 to 17, the only age group showing decreases at this time, indicating that prevention is critical. And then lastly, 2023 and 2024 data, preliminary, is also showing a change. With that, I just want to say that every life is critical, and one life loss is unacceptable. Again, prevention and peers are key in working to shift the dial. And again, I believe that it is important for us to stay the course, to champion the work, and to hold policymakers and system holders accountable, because it's unacceptable to always feel like we're having to chase and say, what about our young people? What about our youth? What about our kids? We equally have to, if not more, make sure that we're getting upstream and really starting to look at how do we prevent all of the things that I've just spoke to. So I want to thank you for joining us on a Monday morning here in Eugene, and I'm just excited to step into discussion and look forward to connecting with you all over lunch and over break. So thank you.